Chloe. I'm an LPN here and I'll be your nurse today. Can you tell me your name and date of birth? Do you have any allergies? Okay, so I see on my orders where you had to insert an indwelling Foley catheter. What that looks like is a small soft tube going directly into your bladder from your urethra, and it's going to help relieve any bladder distension that you have, okay? Do you have any questions regarding that? Alright, so first thing I'm going to do is perform perineal care. So I'm going to wash my hands and put on gloves. And for a lady, we're going to wipe from front to back using soapy water and making sure I change the corners with each swipe, and then rinse and pat dry. And for dry, you want to clean from inner urinary meatus to outward. So I'm going to come over here now that I perform perineal care, take off my gloves, wash my hands, and now I can insert my Foley catheter. So I'm going to pull that out. Just going to insert. Taking the first flap away from me, then the ones on the sides, and now the last flap is going to be towards me. Then I'm going to come, push this up. Alright. Let's put on my sterile gloves. I want to make sure that I don't turn my back on my sterile field. I think just go this way. These are stiff. There it is. I'm going to touch the inside of the glove. Making sure that the outside does not touch anything. And I can readjust it once I have both of them on. I'm going to come over here, just scoop it up. Again, making sure that my hands only touch the inside of the glove. Now I can readjust this side. All right. Now that I'm sterile, go ahead and get my supplies ready. At this point, both of my hands are still sterile, so I can touch this. go ahead and attach my sterile water to the balloon. And I see that it's 10 milliliters, so that's one of the things I'll make sure to document so that when they get ready to take it out, they make sure they took everything. Regarding this urinary cup, I want to leave this open at the time if your specimen was ordered, but since we don't have it ordered, just throw that away. Go ahead and lubricate my catheter tip, and if it was a male, it'd be 5 to 7 inches. Make sure that stays in. Then I'm gonna come over here and now that I'm about to clean her, I gotta hold her labia apart with my left hand, so my left hand won't be sterile anymore. Alright, so about to contaminate my left hand. Since this is a mannequin, okay, so in real life, you would not have whatever this is fall out of their bladder, so I wouldn't have to worry about that. But in the case that something did fall out of their bladder or vaginal area, then you want to restart your sterile procedure. But since real people don't have plastic things just hanging out in their urethra. Alright, so anyway, since it's a mannequin, I can't exactly hold the labias apart because it's rigid. However, with a real person, you want to make sure that you spread those far apart so that the area is thoroughly clean. Alright, so with my sterile hand, I'm clean this out furthest away from me first. Clean the side closest to me. And then clean the one in the middle. Alright, so still making sure that my hand is sterile. I'm gonna hold this 2 to 3 inches away from where we inserted. Then, alright. Take a slow, deep breath for me, honey. Insert it until I see urine return. And as I'm inserting it, I'm still holding it 2 to 3 inches from insertion. Once I see urine return, I'm going to take my left hand, hold that in place, then insert the sterile water. Alright, once I have that inserted, I take that off. We no longer have to be sterile. Tug for resistance and then push it back 1 to 2 inches so it's not seaming the bladder wall. For a lady, I'm going to secure this to her inner thigh. And if it was a guy, it would be secured to his lower abdomen. And I'm leaving some slack up in there so that it's not pulling. And I'm gonna secure this in the bed rail. Make sure there's no kinks or coils in it. Now I can clean up my procedure. Take off these gloves. Perform hand hygiene. Now document how she tolerated the procedure, how much sterile water that I put in, the size of my catheter, and the area, how it was before insertion and after. Alright, so now we can move on to removing the indwelling Foley catheter. Hey, I have an order to remove your indwelling Foley catheter right here. Can you tell me your name and date of birth? Do you have any allergies? Okay, so I'm going to perform hand hygiene. Put on some gloves, and perform peritoneal care before and after removal, if it's indicated, if it's necessary. And I would like to verbalize that if it's a guy, you want to clean from the inner urinary meatus to the outer in a circular motion. Alright, so replace this waterproof pad right here. And secure it. And then secure it. Alright, so now I'm going to use my syringe to withdraw the sterile water, or probably not sterile anymore, and I'm going to allow the pressure to take that back. And it should be 10. That's what we inserted. Alright, so take that off, dispose of that, and then now I can get ready to remove it. Alright, honey. Take a deep breath for me, okay? Making sure the catheter is intact. And I'm going to wrap it up in this pad. Try not to mess up my chest pad too much. Then I'll dispose of this according to facility policy. Take off my gloves. Perform hand hygiene, and I would perform peritoneal care if it's indicated. Then I want to document how much water I removed, how she tolerated removal, and how the area looks after and before removal. Alright, honey, that's it.